Hello from Nairobi. This is the graduation week for our government fellows who have spent the last 8 months working very hard on building a policy reform that will create real change for the countries in which they work. When you are working in government, there are so many mountains to climb. There are economic pressures, fiscal pressures, political pressures, and yet you have the control and ownership of delivering change for the people, but that can feel hard. And so for FAH, our government fellowship has become a really core part of how we see change in the space of health financing and health systems, with an equal investment in 2 legs. The first one is the people, and we really believe that these government fellows, by building their health financing skills, but also the soft skills, the leadership skills, and creating this network of change agents across the continent, they can have a greater impact because their whole career can flourish. And the second leg is the policy or the program that they've decided to lead. And for each of them, this has meant that they have done significant work to create an evidence-based policy recommendation. And now they are carrying that through in terms of real impact through recommendations being adopted, endorsed by the minister, and now creating change on the ground. I've been so impressed by the work of each of our government fellows. And if I can take just one example, it's that we've had a few fellows in Sierra Leone, in Zambia, and also one in Senegal, looking at what is still causing maternal mortality and how can health financing alleviate those barriers, looking at precisely the causes of each of the delays and referrals of pregnant women and directing the resources to those regions where those delays are the greatest. We see the fellowship as a starting point, and this is our second cohort. We're hoping to have a third cohort, but each cohort actually now joins the alumni of this network of excellence across the continent on all topics of health financing and also health systems. And we want to see this as a gift that keeps on giving, that creates a new generation even below the fellows of leaders, and that ultimately is going to be particularly important to continue to see progress towards the SDGs, even in a context of donor transitions on the continent. Ultimately, our lives are not measured by the number of days we live, but the number of lives that we touch. And this fellowship program is meant to be a multiplier for change agents to do so at even greater scale.